You are known globally for your work in preventing and treating prosthetic joint infections. That's what we were talking about the previous question. What recent innovations have improved outcomes for patients requiring revision surgery?
Yeah, at Acıbadem, we have a very strict protocol for managing patients. I was in Kuwait yesterday. We did a case in Kuwait. Some of the infrastructure that we have in Acıbadem is not available elsewhere in the world.
Okay.
For example, we are able to do molecular techniques for isolating DNA of organisms. We have the new sterile antiseptic solutions available. We have different surgical protocols in place. So these are very, very important in one, preventing infection in the first place, but treating infection and getting a better outcome. So we have spent a lot of time in a multidisciplinary form to implement protocols at Acıbadem in Istanbul that, in my opinion, gives patients the best chance of getting cure for an infected joint.
I think this is why the IGC Center at Acıbadem Maslak Hospital is unique and different from other orthopedic centers.
Yeah, and that's why I left Philadelphia after 20 years of practicing there to come and build the IJC in Istanbul. It's a perfect place to build it. We have the multidisciplinary team available. We have the resources. And I agree with you, IJC is the place where I would have my replacement. But of course, I'm biased.
In many countries, revision surgery is a struggle due to missing implant parts or labs. How does your center handle these cases?
We have, as they say in surgery, you have to have a plan A, plan B, and probably a plan C. That means if an implant didn't fit, you have to have the alternative implant to go to as a plan B. In Egypt, I know some implants are not available. So I've had patients from Egypt sent to me by Egyptian surgeons to come and have their surgery done at IJC in Istanbul, where we had those implants available. At IJC, we have A, B, C, and sometimes even D available, just in case things change during the procedure.
Talking about patient traveling to Turkey indicates, that Middle East and National Africa patients used to travel to USA and Europe for complex care. How does Turkey and IGC Center in particular offer a high quality, accessible alternative?
Yeah, look, I practiced in US for 20 odd years. I will tell you that unfortunately, because of some changes, there is a decline in quality of care in US. There is decline in quality of care in Europe. I was frustrated with all of that, and that's why I left US to go to Istanbul.
After all of these years.
It's one of the most beautiful cities in the world. It's an incredibly sophisticated healthcare system. And I would myself have my surgery done in Istanbul, then go back to the US. And in fact, for that matter, we just operated on a very famous Hollywood director who came to Istanbul all the way from United States to have his hip replacement done.
Okay.
So if these people are coming to US, and we're seeing more and more of these people, it is the place, in my opinion, for modern care. You don't have to travel these long distances to Europe and US. You don't have to deal with the visa issues. You don't have to deal with the social political situation. And you don't have to deal with the substandard healthcare in some of those European and US facilities. Come to the best place. IJC is the place to provide you with the ultimate care that will prevent complication and give you the best outcome.
If I'm a patient and I want to reach your center, how can I go there and how can they help me to go to Turkey?
Yeah, you can. If you need joint replacement, you can do International Joint Center. We have a website. Yeah, Acıbadem also has a website. But if your problem is non-orthopedics, just go to the website Acıbadem. There are numbers there, and you should be able to access them. If not, I'm on Instagram. Reach out to me, and I'll be happy to help you in any way I can.
You lead the International Joint Center at Acıbadem Maslak Hospital. What makes the IGC different from other top orthopedic centers worldwide? What advanced technology do you use for safer, more precise joint replacements?
Great question, Dina. Two things. Number one, we do only evidence-based protocols. We do things that the science and research has shown that is the best for the patients. And sometimes that means spending money to have those technologies available. Because of our fantastic leader, Mehmet Ali Bey Aydınlar, who runs the Acıbadem Healthcare, we're not restricted or limited by resources. If I need to buy a robot, I can buy a robot. If I need to have an expensive dressing to prevent an infection, I can have that. If I need to have sophisticated instruments or implants in the operating room, I have access to them. So the fact that you have the evidence-based protocol plus unlimited resources to help you help the patients, it makes IJC a true heaven for me to practice it.
The IGC receives patients from around the world. How does your multidisciplinary approach and follow-up system ensure safe recovery after patients go back to their home countries?
Fantastic question. It starts actually before they travel to Turkey. Through WhatsApp or other means, I do virtual consult. I look at their x-rays, I get their reports from their doctors, and tell them whether we can or cannot help them. I don't want patients to travel all the way to Istanbul for us to turn around to them and tell them we are not offering you an operation. So those who arrive in Istanbul, majority of the time need an operation because we've already seen their records. We have evaluated them virtually. When they come, we do the surgery. I'm spending 3 weeks of the month in Istanbul. I'm around. We have a multidisciplinary team that's around. And interestingly, when they leave, I ask them to give me a report on WhatsApp on a daily basis with pictures of their wound, with their gait, with how they walk, etc. So all of that, we're involved. And sometimes this needs to go on for 3 months. Sometimes every week is enough. So follow-up is much, much better than they would get if they were to go to Europe or United States.
Finally, with AI and advanced prosthetic on the rise, what's your vision for the future of the joint replacement? What challenges will next generation of orthopedic surgeons face?
AI is going to change the face of medicine like it has changed the face of modern society. We already are seeing AI influence us immensely. We actually use AI for diagnosing infection, for preventing infection, and in many other areas at IJC. We have AI experts that help us to implement AI to improve patient care. In terms of joint replacement, it will, one, tell us which patients are not going to benefit from joint replacement, and they are better served by other procedures like joint preservation. It will tell us what protocols we need to have in place to try to minimize risk of any complications like bone breaking after replacement or getting infected like we talked about, and many others. And more importantly, AI will tell us in terms of what type of medications we need to give to our patients in the post-operative period to give them the best pain relief.
Professor, we are so glad to have you here with us. It's such a great honor. It was a really beneficial interview, and I would like to see you again, and welcome to Egypt.
Thank you so much, Tina. It was a pleasure for me to be here.
Thank you so much.
Thank you.